Dimitri, thanks for stopping by my table and the American business expert here in Aventura. I know we've been working for probably close to a year now with SEO, website optimization. We're focusing on very important and trendy keywords to optimize traffic for you. Concierge medicine. If somebody has like a generic insurance plan and they want to get real focused and dial down into their health, is that's what you come in. Can you tell my viewers what makes you different than just a general primary care?
Well, happy to see you, Dennis. I've been using Dennis for about a year now and completely revolutionized our website.
Thank you.
You're welcome. You know, they say that the average doctor visit lasts about 7 minutes, which is about the same time I spend deciding what I want to watch on Netflix. I'm trying to take you from flying coach in healthcare to flying private.
Mm-hmm. Private jet.
Well, yeah, you know, they say like first class, but really first class, you get to the destination at the same time as the coach people. We're trying to get you there much sooner in a much more luxurious way. So there's no wait times in my clinic. You get to spend as much time as you want with me. We do longevity planning, which is you basically trying to make a decision for the next 30, 40 years of your life, what that's going to look like. Try to get you past 120 years by early detection of biomarkers, by biohacking with all the most recent revolutionary peptides that are out there now, by image stacking. You don't settle on just, well, everything basically looks fine. Or like, we don't want basically everything looks fine. We want to know exactly what's wrong with you and then tailor your treatment plan to making sure that we get you incredible results in a luxurious way.
I think that's important, specifically in the South Florida area, a lot more health conscious here. And I'm noticing a lot of people right now, they just don't want to get their markers and their blood test results. They want to go deep down and find out how they can improve, right? That's where you come up with a personal plan to get them from, like, let's say, from like a higher sugar or higher cholesterol to improve their results, right?
Well, that's exactly right. You know, we do advanced blood work with biomarkers. We look at standard things as well. But we want to know every little thing about you. The most recent thing we've added on is genomics. Mm-hmm. So genetic risks of developing cancer, genetic risk of heart disease, genetic risk of Alzheimer's. We do all of those things and more. And then tailor the plan to that specific epigenetics to making sure that whatever treatment plan we do pick for you, it's the appropriate one. And on top of that, we do something called calendar tracking, which is you don't necessarily say, well, I'll see you in a year. We see you once a month, quarterly, or as often as you need to making sure we keep you on track. It's something like almost like an accountability coach.
Mm-hmm. Yeah, that's important.
Where, you know, yeah, exactly. Like you say, well, I'll see my doctor in a year, if even then. My whole goal is to develop a lifelong relationship with my patients where you know there's a trusted person that you can call upon, kind of like Patch Adams, you know, like it's a learned friend that you can call for advice.
So if somebody has an issue, an emergency, they can just pick up their phone, they have access to your cell phone, text you or call you with any question regarding their health.
Exactly, you know, 24/7.
Okay.
There's no wait times.
That's perfect. So how does one get access to your program? Is it special VIP access, or how does one, if they want to get more information, they live in the Miami area, how do they get access?
So the way to do that is you call my office and you schedule a meet and greet with me. We make sure we're on the same page, make sure we like each other, you know, and then we make a decision whether or not we want to go from there. You know, I try to provide the best healthcare experience possible for people. If that's something you're looking for, give my office a call. I'm more than happy to help.
And I heard like a rumor that you're launching your own supplements. So can people purchase high quality products soon from your office?
Yeah, so that's already live.
Okay.
We use a company called Orthomolecular. You know, buying supplements is a bit of a challenge to know what kind of quality that you're getting. You know, things are available on Amazon, you might be getting something from China. Mm-hmm. I had a guy come to me once and he's like, yeah, I'm launching my own supplement line. And I'm like, that's cool, like, what are you doing with that? He's like, yeah, my buddy owns a vat company, and I just went over with a scoop and I just fill a bag up and I sell it for $60. I'm like, holy moly, like, you have no idea what you're getting, you know?
Everybody has different genetic markups, so all the supplements have to be curated properly.
Yeah, that's right. I mean, one of the big things that we do is weight loss, so I try to put people on like a multivitamin that has the appropriate nutritional needs for the patient experiencing significant weight loss. So when you're doing that, you're changing your body, and you're also sometimes depriving yourself of certain micronutrients. So we try to tailor it to the patient. Specifically, for example, if someone has a family history of heart disease, things like selenium and CoQ10, right? Maybe a little niacin, which is vitamin B3. And, for other genetic predispositions, maybe you want to tailor that to them. If they have someone having bad sleep, add magnesium, right? People with testosterone deficiencies, I put them on DHEA. Specifically for women, they're usually deficient in DHEA.
So you have access to full spectrum medical, like primary, but also concierge, where you can sit down as long as it takes to figure out the problem and come up with a solution.
That's right. It's not like I run in the office with my white coat, write you a script, throw it at you, and leave. Half the times I'm trying to get people off medications. It's called deprescribing, right? People hate taking medications, especially lifelong. There was an article published in the Journal of American Medical Association talking about just about that doctors are afraid to take people off their medication. They've been on for 30 years, leave them. Listen, your body changes as you get older. Maybe you need to get off of something.
So do you consider yourself integrative medicine? Like where you actually use like holistic approaches? Even though you
all of these like catchphrases, whether it's integrative, functional,
right.
biohacking, all of that stuff. What I call myself is a preventative doctor. I try to stop things before they cause problems, catch it early, and get people amazing results.
Right.
I think all of these monikers are just, the main thing is to find a doctor that you trust, that you're going to develop a relationship with, somebody you can call upon when you're in need.
Got it. Okay, makes sense. Well, if somebody's in the Miami or South Florida area, how do they schedule the first consultation with you? What's the call to action? They go to the website, they call you?
Yeah, so
What's
our
your
website is Gitelcare.com. I'm Dr. Gitelmaker. I thought it was a cute play on name. So it's Gitelcare.com.
Awesome.
Or call my office at 305-771-0034. Or you can email us at info@Gitelcare.com.
Awesome. Dr. Dimitri, thanks for stopping by.
If you're looking for the best SEO team in the market, then it's the guy. Also, he's doing our SEM. He's doing the whole spectrum of media component.
We're doing a very concierge approach when it comes to digital marketing strategy, and Dimitri and his staff has been a great case study for us. So we're only hoping for even better results as we grow.
I think we got on page 1 on Google, actually, just recently.
We're working on it, yes.
Yeah.
Thank you.
I want to be that #1 spot there.